Hello and welcome to this session of the Healthcare of the Client 3 course. We will begin our discussion on reproduction by discussing sexuality. Sexuality is a very complex concept and cannot be fully addressed in this course. However, we should have a working understanding of human sexuality to provide competent care for our patients. And so this session will introduce you to sexuality and its impact on reproduction. Before we proceed, let me take this opportunity to remind you of our concept objectives. At the end of this session, you, the student, should be able to define and describe the concept of sexuality. You should be able to identify risk factors for problems with sexuality and sexually transmitted infections. Recognize when an individual has a problem with sexuality and provide appropriate nursing and collaborative interventions to support optimal sexuality. So, as we continue our discussion, let's look at some definitions in relation to sexuality. Sexuality, according to the World Health Organization, is a central aspect of being human throughout life, which encompasses sex, gender identities, and roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. Sexuality is experienced and expressed in our thoughts, fantasies, desires, beliefs, attitudes, values, behaviors, practices, roles, and relationships. So this means that sexuality is expressed and experienced in our everyday life. While sexuality can include all of these dimensions, not all of them are always experienced or expressed, and this will in turn lead to an impairment in our sexuality. Sexuality is influenced by the interaction of biological, psychological, social, economic, political, cultural, legal, historical, religious, as well as spiritual factors. The CDC also defines sexual health as a state of well-being in relation to sexuality across the lifespan, and it also mentions that our sexuality involves the physical, emotional, mental, social, and spiritual dimensions. Sexual health is intrinsic to human health and is based on a positive, equitable, and respectful approach to sexuality, relationships, and reproduction that is free of coercion, fear, discrimination, stigma, shame, and violence, because as we will learn, all of these factors, if not fully developed, is going to impair our sexuality. It will also be helpful to understand these key terms as listed and defined in your textbook. So take a time to look at these definitions as we continue our discussion. So, what are examples of sexual ill-being or dysfunction? And in what ways does culture impact this perspective of sexuality? We know that sexuality is a continuum which begins from sexual well-being or optimal sexual functioning to sexual ill-being to sexual dysfunctioning. There are some physiological processes of sexuality. Nurses must know the relationship between sexual response, the effect of age-related changes on sexuality, and sexual attitudes and behaviors. An individual must have a motivation, also known as libido, to want to engage in a sexual act. Libido affects arousal, which is a physiological response to stimulate parts of the brain to cause genital congestion that causes erection, or that can also cause orgasm. An orgasm results from the sensation of pleasure obtained from the rapid contraction of the muscles in the genital and anal area. This pleasure causes a sense of well-being and muscular relaxation through the whole body. This is also known as resolution. We will not dive deep into sexual response as this is not the focus of this class, but we should know that there have to be the physiological response present and the psychological response for orgasm to take place and for a person to have pleasure in a sexual activity. The lack of any of these components will result in an impairment. So, sexuality is a developmental process which begins at conception with the formation of genital organs and progresses all the way till death. Sexual response begins during infancy and childhood because infants experience genital congestion also, and this is marked by erections in boys and increased vaginal lubrication in girls. Infants of both sexes have been observed to fondle their own genitals, and this is a natural form of sexual expression and arousal. The nurse should educate parents that attitudes and behaviors they demonstrate, such as shaming a child when they are fondling, will affect the child's sexual development and gender identity. Also, the nurse should note that children model adult behaviors through playing, example when they play house or play doctor as part of their natural curiosity. And so parents should foster positive physical contact and provide quality relationships for the child to develop healthy sexual and emotional relationships later in life. If the child doesn't have a positive physical contact, this is going to lead to the development of some sexual practices which may not be positive for their development. Adolescents also have some changes associated to the sex organs which becomes evident during the period of adolescence. The adolescents learn to manage their physical and emotional aspects of sexuality in order to form intimate relations, and resolving the conflict between identity and role confusion from social experiences such as those that they see in society as to what is masculine or feminine. So through social norms, they may develop good behaviors or behaviors that may be an impairment to their sexual functions, because social norms may affect or inhibit sexual expression during this stage. They begin to develop their gender and sexual identities as they are perceived and also perceive their attractiveness and attraction to others. So they begin to think about if they are attracted to males, to females, if they are bisexual, if they are queer, or whatever other classifications are there. They may identify as heterosexual, homosexual, which is lesbian or gay, bisexual or transgendered. The adolescent is at a high risk or is at the highest risk for unplanned pregnancies as well as STIs because of them trying to find their identity. They might engage in risky behaviors such as unprotected sex, which puts them at higher risk. The nurse working with this group should provide teaching not as a directive but for information, so you cannot mandate them on what they should do, but you can give them counseling and guidance and then help them to make the choices by themselves. The nurse must also learn to provide supportive services without being condescending or judgmental, even if the nurse does not share the same belief or approve of the sexual expression of the adolescent client. During the adult years, such as 20 years and older, the process of sexual maturation continues throughout a lifetime. Adults are mostly aware of their sexuality depending on whether they had a positive sexual development or if they had an experience that impaired proper development. So adults may choose to commit to a sexual lifestyle including polygamy, monogamy, long-term, short-term relationship based on their preferences, their values, social norms as we talked about. In older adults, they may also experience some decreases in libido, and so that may affect their sexual pleasure and that may affect their overall sexual activity. However, we should know that older adults, such as those that are older than 55, still can engage in sexual activity. In fact, there has been recent spats of sexually transmitted infections in older adult living homes, such as the nursing homes. There are many factors that affect sexual health. Sexual health is affected by a client's biology, such as body and body processes, societal norms, that is acceptable and what is not acceptable, or our culture, which may determine the roles in relationships. As I mentioned earlier, someone may develop roles as they observe what is accepted in the community, what is the culture, what is the definition of masculinity or femininity. For example, the loss of a spouse can also change the sexual preferences of people depending on the cause of that loss, such as if the partner is deceased or if there is a divorce. This may increase the likelihood for a client to engage or have a decreased motivation for sex, and thus abstain from sexual relationships. On the other hand, it can cause the client to engage in risky sexual behaviors, which is having multiple partners or trying out new things, and that the nurse should be aware of the client's stage of development to be able to provide adequate collaborative care. So now let's look at some variations of our concept. Sexual expression differs from client to client. So as such, sexual dysfunction is based on the client's perception and the presence of an actual impairment to sexual functioning. Sexual dysfunction can be caused by physiological factors. For example, cardiovascular disease such as heart failure, respiratory illnesses such as COPD, musculoskeletal conditions such as back pain or paralysis or surgery, and neurological conditions such as paralysis or memory loss, as I talked about, and endocrine such as hypothyroidism, can all result in sexual dysfunction because they are going to decrease the drive or the libido for sex. We should remember that this is not an exhaustive list. There are many other conditions that can affect sexuality. Other examples include an acute illness, such cancer, an infection, surgery, trauma, medications, especially if you have ACE inhibitors, loss of mobility, decreased activity tolerance, such as with patients that have COPD or that are at an older age, and then hormonal changes. For example, older women who are menopausal may have dryness of the genitals, and so they might not have pleasure in sexual activity. And also, alcohol, substance abuse are some physiological conditions that can contribute to alterations in sexual function. Pregnancy and the process of aging, although not pathological conditions, can also result in sexual dysfunction. Prescription drugs for managing physiological illnesses can also affect hormonal and body processes to cause sexual dysfunction. Drugs such as antihypertensives, especially ACE inhibitors, beta blockers, and beta agonists, as well as diuretics, can alter sexual function. Anti-ulcer medications such as cimetidine, omeprazole, antidepressants, antipsychotics, anticonvulsants, and narcotics can affect the desire to have sex and sexual response. There are also some psychological factors including fear, anxiety, fatigue, reproduction, health concerns, and adverse childhood events which can result in sexual dysfunction. As I mentioned, sexuality is affected by our culture and our environment. So if somebody or if a client doesn't have a positive experience with their first sexual contact, that can cause an impairment later on in life. There are also alterations in body image and self-image, role confusion, and personal conflicts, such as somebody may identify, for example, and this is just an example, somebody may identify as transgender or gay or lesbian, but because their religion frowns on it, that will cause them anxiety and will not allow them to express their sexuality, and this can also lead to sexual impairment. Culture and values, as well as mental health conditions such as psychosis or alterations in cognition related to dementia, will also impact an individual's sexuality. In addition, you have maturational factors, and these are conditions that affect sexual maturity and may be as a result of knowledge deficit with regard to sexuality. For example, birth control, safer sex practices, and changes associated with aging. Maturation is also associated with culture and religion and also social norms, because these forms the fabric of our environment or our society. Our society determines what is normal, what is abnormal, and this can prevent a client from forming intimate and social relationships necessary for sexual expression and sexual pleasure. So now let's look at some risk factors. There are many individual risk factors that can contribute to problems related to sexuality and sexual expression. Behaviors such as multiple and casual partners, unprotected sex, can lead to infections which will create sexual ill-being and impair reproduction. The use of alcohol, substance abuse such as use of illegal drugs or illicit substances can impair judgment, leading to engagement in risky behaviors. The sharing of needles associated with certain drug use or IV drug use such as meth can also promote infection and sexual ill-being. There are certain populations that can also be at greater risk for sexual impairment. One of them are adolescents. Adolescents have a high risk for teenage pregnancy and sexually transmitted infections. This is mainly because of hormonal changes and their lack of a well-developed sexual awareness, and therefore they tend to be more promiscuous and to be not committed to long-term relationships. Minorities have difficulty accessing healthcare, and as such, detection of problems associated with sexuality, such as infections or abuse, are delayed, and this can also impair their ability to have good sexual health or to be in a sexual well being. Also, clients with disabilities are more likely to suffer from sexual abuse, thereby increasing their potential to develop good sexual health. They may also suffer abuse for longer periods due to their inability to report, and so this will mar their sexual expression, and they may be fearful of engaging in sexual activities. Disabilities such as malformations, um, growth retardation, somebody, for example, that has cerebral palsy may not have all the developmental components in regards to the physiological processes that have to happen for sexual pleasure to be obtained or attained. So, let's look at how we can assess sexuality. Major indications of sexual health include normal sexual history. Sexual history may include the 5 Ps, and we will talk about this as we progress. The absence of previous reproductive disease and the absence of current symptoms of reproductive disease, such as normal pap smear test results or normal menstrual history, will all be good indicators of sexual health. The nurse should assess for the 5 Ps in addition to the element of any sexual history. So, in assessing for the 5 Ps, you want to ask the patient about practices and partners, whether the client is in a monogamous relationship, a polygamous relationship, same sex relationship, or heterosexual relationship. Ask if they are using any protection against infection, such as do they have good knowledge about condom use, contraceptive use, and other ways of preventing, sexually transmitted infection. This should also include if the client has received vaccinations against certain sexually transmitted infections. Then the nurse should proceed to ask about past history of sexually transmitted infections, because these are important to determine the client risk if they can infect others or if they stand a higher risk of recurring infections. Finally, the nurse should ask about the use of contraception in preventing unplanned pregnancies. And so all these components of the sexual history will give a good background as to whether the patient is at a higher risk or not. After assessing for the history, then the nurse should move on to the physical examination, and this includes the female physical examination. The female physical examination includes the examination of the external genitalia and internal structures, external inspection and palpation of the breast, internal inspection of the vagina and the cervix, and also the bimanual palpation of the uterus and ovaries to make sure that all these structures are in their rightful anatomical positions. Then there is also the collection of specimens as needed, such as pap smear, biopsies, urine for urinalysis and pregnancy testing. And pelvic examination is usually performed by physicians or nurse practitioners. The role of the nurse is to assist the provider during these examinations with supplies and positioning of the client. In assessing the male, the nurse has to examine the genitalia and involves the inspection and palpation of the genitalia. So external inspection and palpation of the penis, scrotum, and testicles for testicular descent, ulcerations, on any part of the penis or the testes, or penile abnormalities such as if the meatus is underneath or the penis or in the right position. There is also the digital rectal examination for prostate enlargement, especially in older men, and the collection of specimens as needed, such as semen for sperm count and semen analysis, or urine for testing for UTI, STIs, and other infections. The male examination is usually performed also by physicians or nurse practitioners, with the nurse providing assistance. So these are some links to your evolved content which demonstrates the assessment of all that we have talked about. So make sure you go and you click on the link and you review these videos. Now that we have looked at the assessment piece, let's look at some nursing considerations and prevention. Unprotected intercourse, multiple sex partners, adolescent onset intercourse, sharing of intravenous needles, and a current diagnosis and history of STIs are all factors which increase a client's risk for poor sexual health. While the goal of primary prevention is to provide a client with knowledge and resources for healthy sexual choices, secondary prevention focuses on the early diagnosis of sexual impairment or disease related to sexual health for prompt treatment. Secondary prevention includes screening for STIs during a well-check visit or a visit to the prenatal clinic or to any other clinic. There are many pop-up clinics that will do STI testing for free, and so you as the nurse will have to encourage the patients to be able to test for these. There is also intimate partner abuse and violence and sexual assault and child molestation, which can be identified through secondary screenings for prompt treatment or for counseling or the removal of the client from such an environment. There are certain groups and populations that need special attention when it comes to sexuality. Clients who identify as lesbian, gay, bisexual, transgender, and questioning, known as the LGBTQ, may have unique needs related to sexual health and prevention or treatment of sexually related infections. The nurse should realize that the overall health status of people in these populations may be poor due to discrimination, healthcare inequalities, which means they are not able to have good access to healthcare because of the discrimination against this population, and the lack of healthcare provider understanding of this community. There are many healthcare providers who don't know much about the culture of the LGBTQ community. The nurse should be careful to minimize or remove any such barriers by establishing rapport and avoiding personal opinions, biases, as well as stereotypes, especially during the health history taking. For example, among transgender people, opportunities for physical examination are avoided or missed by both the patient and the care provider because of fears of being misunderstood or being inadequately prepared to give or receive appropriate care. Sexuality and issues related to sexual health are often sensitive, personal, and controversial, and nurses must respect the patient's lifestyle, and providing confidentiality is essential for patients to receive correct information, making and for them to be able to make informed decisions and obtain appropriate care. So if you are about to assess a person who may identify as transgender or as gay or lesbian, because of the nature of their gender, they may have some fears because they don't know how you are going to perceive them. And so being open to their sexual preferences, not that you accept whatever their sexual preferences, but you still should be able to provide care without being judgmental. Remember that we said that sexual expression can take many forms, and individuals should be able to express their sexuality without coercion or judgment. And so you as the nurse should be able to maintain that rapport between you and the patient to let them know that it is okay for them to trust you and that you are going to give them the best of care no matter what your beliefs or values are, whether they are different from the client or not. So there are many concepts that are related to the concept of sexuality. So to recap, sexuality is an integral part of reproduction. Sexuality can affect or be affected by psychosocial, emotional, and physiological factors or status of the client. Nurses should assess their own culture to identify any biases and prejudice or stereotypes and work to provide fair, non-judgmental treatment for all clients. We will complete some in-class activities to help you apply your readings and the knowledge from this concept in the classroom when we meet. So it will therefore be helpful for you to complete all the readings, assignments, and any other assigned materials prior to class so that we can have a good in-class session, and also write down your questions so we can talk about these. Thank you for listening to this presentation, and if you have any questions, email me ahead of time or bring your questions to class and we will have a good discussion about that.